Almost 8 weeks after the Ministry of Health launched its revitalized primary healthcare program in St. Patrick, health administrators continues to move swiftly to ensure that facilities and the availability of services in St. Patrick, St. Mark and St. John are up to mark. However, one of the areas of concern for the Ministry of Health is St. John, which has been without a proper facility for the provision of adequate services for almost 4 years. On Wednesday, Director of Primary Healthcare, Dr. Francis Martin, told the Government Information Service that a new building has been identified in the town of Gouyave where the PHC services will be provided.
All right, well, the new facility, we had to look for one that would give us additional space to be able to offer the kind of integrated and comprehensive service that we hope to achieve under the primary healthcare program. It also gives us an opportunity to give extended hours, which is something we've already started. We have identified a building in Gouyave. I think it's around the Lower Depredin Street area. It affords better parking, and most importantly, it gives us additional space to be able to run the different clinics all under one roof, so that the nurses and the doctors and the healthcare professionals can operate under a very comfortable setting.
According to Dr. Martin, in the coming weeks, he expects residents to access a range of services and clinics.
Well, in the coming weeks, when the station opens up, then we expect people to be able to access their physician for extended hours of time, for more hours in the day than what is usually obtained. As a matter of fact, within the next week or two, you should actually be having more clinics in that area compared to what was there before. And then when we do get the entire building and we get all of the nuts and bolts in place, then we should expect to have extended hours of service and comprehensive and integrated service.
The primary healthcare director told the GIS News that there have been noticeable increases in the services since the St. Patrick's launch.
Over the last few weeks, especially in St. Patrick area, we have noticed a significant increase in the numbers of home visits having done by the nurses. Also, because of the extension of hours, we are also seeing increasing numbers of persons accessing care. So we do expect to see more and more persons coming in. I don't know the exact number, but from a statistical standpoint, the overall is that almost 100% increase in number of home visits that has been done. And we expect that same kind of numbers to reflect themselves in the St. John's area and the St. Mark area when we do have the building and start operating from that place.
I am Kevin Frederick reporting for GIS News.